So since our last meeting on February 22nd, I have two main updates that come from the province. From a provincial perspective, what's changed is one, the framework and where we've moved into in the color zone. And two, I have an update in regards to funding. So in regards to the color zone, when last we met, we were still in gray, and we have now moved into red control zone effective March 1st. So to help with that, we've posted an FAQ on our website about red control as well as the Section 22 order. And we've done a media release and some outreach to various groups like our short-term rental operators so they can understand those changes. I'm excited about my next update because it relates to funding. And last week on Thursday, the Ministry of Municipal Affairs and Housing announced that the Government of Ontario is providing an additional $500 million to municipal governments. So that will be divided amongst all 444 municipalities, and it's based on a base formula plus a formula allocation, which recognizes the impacts in various areas. So there's basically a top up based on the number of COVID-19 cases between January 1st, 2021 and February 18th. So for Niagara-on-the-Lake, this means an investment of $427,000 and $427,007 exactly. So we're delighted about that. It will come in two installments. The first will be before May 1st, and the second will be before November 1st. And that is to be used to reduce the impact on municipal operations and pressures as related to COVID. So I am sure that people are wondering about the vaccine program, and that's been a hot topic. So fortunately, last week we received more information from Niagara Region on that. On March 4th, they announced that much anticipated planned locations for COVID-19. There will be 11 mass vaccine clinics located in the Niagara region. And for Niagara-on-the-Lake, that will be the community center. So they have confirmed that for us. They've been strategically located so that no resident has to travel further than 15 minutes to receive a vaccine. And they continue also to consider other larger centers like the Seymour Hanna facility, where they can work in coordination with Niagara Health and administer more once they've done the mandated one from the province. Because as you know, the province dictates how they will be rolled out. So there's the Provincial Framework, which is the 3-phase. They've moved into phase 2. And a lot of the questions we've seen in the community is, why have some communities received more vaccinations than we have? Well, that's because the vaccines were determined by the province where they would go, and Niagara just didn't get them as rapidly. However, we are now deemed a hotspot, and we're seeing that we'll receive more vaccinations and we'll be able to roll out more. That said, there have been over 23,000 vaccines distributed in Niagara so far, and that was effective last week, so it could be even further now. So you'll see that the first group to get vaccinated in the second phase will be those 80 years of age or older and Indigenous adults. And then public health will follow that provincial prioritization, moving progressively through to younger age groups until all persons 60 years of age or older have been vaccinated. And they hope to have that done by the fall. And then, of course, everyone will follow at that point. And I'll just let everyone know as well that many people are anxious to book their appointments. You can't do that yet. They're following the provincial online booking system. So that is suspected to come online March the 15th, and then there will be the ability to do it online or by phone. So we're keeping a close eye on that. There were also a lot of people who reached out about volunteering, and we had some questions at the last council meeting or committee of the whole. No, it was council, and how people might volunteer. So we have now been redirecting people to Niagara Region because they have a great need for this. Volunteerism will help significantly in the delivery of the vaccines. So they've posted, and it's great news because they've had an overwhelmingly positive response. and they're actually going to close that posting on March the 10th. They've had such a good turnout. So there's different roles that people can volunteer for. For example, there's clinic setup, because they all need to be set up in a certain way. They have people monitoring the flow to make sure people hand sanitize, wear their masks, and go to the next right spot in the immunization process. And then they have recovery assistants who just watch and make sure that people stay there for the recommended duration and that they're feeling okay before they leave. So stay tuned for more on that. So how does that impact us here in Niagara-on-the-Lake? Well, as I mentioned earlier, our site will be the community center, and we put out a media release last week about that also. We've also announced, now that we have more details about what's happening with the immunization at that site, that we will be reopening the community center. We've had a number of people in the community reach out. We wanted to make sure we could safely open, that we could put all the safety measures in place and make sure we had the appropriate amount of staff there to open it, like I said, safely. We also wanted to know the impact of the clinic itself, because we weren't sure how many days or whether we would be allowed to have people there while clinics were taking place. So we now know that on the days that the clinics are not in place at the community center, we can stay open. So it will open on Monday. We are still waiting for the schedule, and as soon as we have that, we'll share that and let folks know what the impact is. From an enforcement front, continues to be pretty quiet, which is positive. It means that people are following the rules and staying safe. We do have our enforcement staff reviewing the regulations, however, in anticipation of moving into orange. While that hasn't been announced yet, we want to make sure that we're aware of all the regulations and have proactive communications prepared so we can immediately be ready for orange when the time comes. So on the good news front, we are preparing to put out a customer service survey, because silver lining of COVID has been we've had to adapt our technology and start to deliver service in a different way. So we want to see how the community is responding to that, if we're doing a good job, and how we might improve. So you'll see that go out in the next week or so, and we'll let you know what the feedback was we received and how we might adapt even further to continuously improve. It's almost at the 1-year anniversary mark of when COVID arose for us. So we're partnering across the region with various municipalities. The mayors are going to put out a letter, and you'll see that the flags will be at, well, our flags have been at half-mast since April, but you'll see other communities lower their flags on the March 12th to 14th, and you'll see us light up a flag post at that point. Just a quick update on mental health and wellness. So you're aware we've been doing our best to support our staff. Mental health has been very negatively impacted, as you know, during the COVID timeframe. So senior management and HR have been working really hard with our staff to make sure they have all the supports that they need in place. We had a breakout session to get feedback from people about what's been difficult for them, what's working well, how we can support them better. So we continue to do that, and we continue to provide supports on our website for the public as well. We also have started a postcard initiative. The community engagement team is working to put together this initiative, which highlights some of the great photos submitted through our photo contest last year. This is just in an effort to keep people connected with family and friends. So residents will be invited to sign up and receive a prepaid postcard with the spring-themed photos, and they'll be able to send out a postcard. This is similar to what Canada Post did. Now, of course, we have a limit to how many we'll put out there, and we'll cap it. But this is just a nice way for people to outreach and say, hey, I'm thinking of you during this difficult time frame. So that's my update for today, and I would just also like to close out by saying Happy International Women's Day. We put out a letter and a video, so check it out if you have time.